All right. So today, quick discussion on article or research article that was out in March this year. They were doing some controlled trials, randomized controlled trials around manual therapy and neck exercises for treating kind of non-specific neck pain. So people that just kind of have a general neck pain issues. And it was interesting. It's something that I've noticed in practice over the years as well. But what's interesting is the effectiveness of both manual treatments and exercise was equal during the course of the trial. So people that, but there's a catch there. The only time where there was equal outcomes between manual therapies and exercise is if there was high adherence to the exercise. And that's always going to be the catch when you're working with the general public as it relates to musculoskeletal pain conditions, is the willingness of the person you're working with to do what you're asking them to do and to follow through with a course of prescribed or however you want to describe it, exercise plan for their condition. So exercise is not effective if they don't do it. Exercise is effective if they do it. And therein lies the problem, right? It's not easy when you're working with large swaths of the general population when it comes to musculoskeletal pain conditions. It's not easy to find patients that are going to do the exercises as you prescribe them to the person and to follow through with them for the course of the time that you tell them they're going to need to do those types of things. Many people are just conditioned to have something done to them. They see the industry of musculoskeletal care as a passive endeavor on their end, that they should be able to go to some sort of therapist, doctor, chiropractor, physical therapist, whoever, massage therapist, whatever it might be, and that person will remove the pain for you, right? But if you look at studies like this, and it makes sense, and stuff I've seen play out clinically when I've worked with people for the last almost 20 years, is people are more than capable of correcting and improving their own symptoms if they are given things to do that are going to be effective, and if they follow through with doing those things. So what we all need to be doing is helping people understand that they are more than capable of correcting these issues themselves if there's nothing pathological or big going on underneath. If we're just talking about general soreness and stiffness, hey, you can go do these things and you're going to get better. The problem there is the person actually doing the things. And then the other reason we don't see that strategy employed that much in the professions is because it's difficult to get paid to just tell somebody to go exercise, and there's not that recurring patient appointment for the business model of having the person come back over and over for 12 weeks, 16 weeks for this manual therapy that you're going to do to them. There's money to be made there. There's a business model there. There's not so much a business model for telling somebody, do these things for the next 12 weeks. Let me know how you feel. And then the downside of that, of course, is that the person doesn't do any of those things, they're not going to feel better. But if they do the exercise plans, they can have just as effective an outcome as if you were doing something to them for those same 12 weeks. So there's something to think about, something for you guys to chew on. And that's all I got for a day. Check my channel for more, and see you later.